Hello, listeners. I hope you're doing okay. We are doing a mini here today while I prepare a longer podcast, another one from A Path Through the Jungle by Professor Steve Peters on depression. So I've done a series on anxiety, 3 of them. Well, the first one was really PrEP, and then 2 on anxiety, and a depression one is coming. So hold your horses. It's coming. Today, I thought I would talk about hypnosis and the physical effects of it. Again, this is a mini, so it's going to be pretty short. Hypnosis has physical effects. That's why we do it, is for physical effects. That's why we do any therapy, so that our bodies feel better. When our minds feel better, our bodies feel better. But hypnosis, there's actually a lot of research about all the different systems in the body it can affect. Meaning your autonomic nervous system, your central nervous system, tissues. There's a lot of research on the GI system, and they actually took samples of the tissue from the bowel, and the tissue changed in the hypnosis group. People bleed less during surgery. This is physical effects on the body. And, they use all kinds of statistical techniques to figure out whether this is a real effect or whether it's placebo. Not that placebo isn't anything to sneeze at, right? Like placebo is a fantastic effect. If you get a placebo effect going on, that's to your benefit. Absolutely. But they do statistical analysis to see, was this a waste of time for us and all our research money, or did this actually have some benefit to the person? So hypnosis has all kinds of benefits. When they do fMRIs on it, it looks very similar to pain medication in the brain. Incredible. Like incredible. I've definitely experienced this myself when I twist my ankles. You guys, I have hypermobile ankles and I twist them quite frequently. In fact, I was super happy when I went a year and a half without twisting an ankle. And then I twisted my right ankle, and immediately I did hypnosis to bring the pain down. It was a pretty painful twist, that one. I was looking at an iguana instead of looking where I was stepping. Big mistake. Look where you're stepping. Don't look at the iguana. I don't know, probably my hindbrain took over and was thinking, oh my God, what's the bigger safety concern here, the iguana or the stepping? Now, this was a friendly iguana named Millie that lived outside of our house in South Florida. So probably safety, looking where I was stepping, was a larger priority. But, your hindbrain doesn't always know that. It probably just sees the iguana and is like, oh no, keep your eyes on the threat. Who knows? Anyway. I've used it multiple times in my life to bring down pain, to bring down inflammation in the body when I was having eye surgeries and complications in my right eye. Like, it's not just about habit change. I mean, habit change is huge, by the way. Like, people use it to lose weight all the time. But that is habit change in terms of eating patterns. To stop smoking, that's habit change. But talk about physical effects in the body. Really, stop smoking. All kinds of things improve in your body. But that's not really what we're talking about. Like, that's a side effect, is what I call that from hypnosis, versus like this is a direct effect from it. That's more like the fMRI studies and the tissue samples that they take and all kinds of stuff like that. Direct effect. Now, sometimes people will have a physical effect right after the hypnosis. Usually they feel fantastic. That's a physical effect. They feel very floaty, sort of like the end of a yoga class when you've had a really good savasana. Savasana was always really hard for me, but when you've had a good savasana and you're like, oh, I have the yoga glow. 95% of the time, people have that. They feel really good after hypnosis. But occasionally, someone has something that doesn't feel so good, like nausea or some dizziness. And it's like, yeah, because hypnosis has an effect on your nervous system. Now, typically that will pass within a couple of hours. And what I've done in the past when that happens with somebody is give them vagus nerve soothing exercises like the bumblebee breath where boo, 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 boo. You're doing that sort of with your lips like a bumblebee would. or tapping in different parts of the body, some very gentle breathing. So we're calming down the nervous system that had a reaction. So it's just something to know as you move forward in your journey with hypnosis. We're going to end here. It's a mini. Keep your eyes open for the episode coming up about depression. I hope you're healthy and safe. Peace. I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis, so if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace. This podcast is not mental health treatment, nor should it replace mental health treatment. If you need therapy or hypnotherapy, please seek treatment from a trained professional.